So the easy answer for patients who already have a PCP or a primary care physician is you can call your doctor and then just ask, or you can talk with them and say, "Hey, I have a friend or a family member who has COVID, and I was in contact with them. I would like to get tested." At that point, your doctor would hopefully say, "Sure, let's get that set up for you," and they would place an order. And you would receive a call from a local testing center or site to come in to get that test in particular. If you don't have a doctor, it gets a little bit trickier. Some other options you can do are you can call your local pharmacy, and that could be CVS, Walgreens, what have you. And many of those facilities do have the tests available on site if you were to talk to the pharmacist. So you can go to have those done as well. One thing that may also work is you can contact your local health department. And particularly in Vermont, many of us generally call the Vermont Department of Health. I have done that for myself and for my kids. And the Department of Health will basically ask you, "Hey, have you had any exposures? Have you had any symptoms? What have you?" And you follow up with a test, and they basically tell you to go to this site or go to this facility, and they walk you through it. They tell you, what you need to do for the test itself, and when to expect a call back regarding the results. And they really try to help navigate that process for you. That way, there isn't too much thinking around it. Where things may vary a little bit is what kind of test is done. And really, there are three flavors at this point that we're using for testing. And I'll try to go through those briefly if I can, just to help explain it more. But you have the home test, which is what we call like the rapid test that a lot of people have heard about. You can buy those at the store for the most part. They tend to be kind of pricey. So we're finding that health departments, if you were to go get testing, sometimes they will give you test kits to bring home to perform it that way. But these tests, these rapid tests, are designed to be done very quickly, and they pick up results after about 15 minutes total. So you're able to figure out if you have a COVID infection within that short time frame, which is great. The other test that they have, though, is what we call a PCR test. And the reason we have an additional test is because this PCR test is what we call sensitive. So it's easier to pick up COVID on this test than it would be on a rapid test. And I know that can be kind of confusing to think about. So let me paint a picture. Let's say I was, talking with my brother, or I spent the night with my brother, and he had COVID, and I just found out that next day. I want to go get tested. So I call my local department, the Vermont Department of Health. They say, "Okay, come on in. We'll get you a home test. That way you can bring it home and test yourself." So I say, "Okay, no problem." So I do the nasal swab, which is a Q-tip, and you just circle it through your nose a few times, and then you put it in some liquid. It's very gross, but it works fast. So after that test is done, let's say I'm negative, which is great. Like, yay, I'm free of COVID. But I still feel really sick and I still feel really uncomfortable. So I call the health department again, and they say, I wonder if that test didn't pick up the COVID when you first tested yourself. So let's do a PCR. And a PCR test is done the same exact way with the Q-tip swab, but it's very, very, very sensitive at picking up COVID. So it can really get a sample if there is one there. So I do the PCR test, and that test shows up positive. So what that means is that the rapid test, it can help with finding COVID. It doesn't always work as well as the PCR test, but it's a quicker test to determine if that's what's going on. Another test, and I'll just run through this last one briefly, and then I'm happy to entertain more questions. But another test that you can do is the LAMP test, LAMP. And essentially what that is basically it's a PCR test. So it's that really sensitive test that you do at the health department. You can do that test at home. That's harder to come by because they're in shorter supply, and they're actually being given out more for many school-age children in daycares. But if you are able to get your hands on one, which you sometimes can do through schools, that LAMP test is actually really accurate. and it can show a positive COVID test in about 30 minutes. So that's another option. If it's a bit tricky to do a PCR test at a testing center, is to maybe have a lab test performed. And again, many schools are primary areas and groups that are doing that.